Hi, everybody. Welcome back. As we talked about earlier today, we are trying to do a series on barbicide.com of some of the professionals out in the field that we feel could be helpful to you beyond what we already do. I want to introduce you to our president at King Research, Alan Murphy, who is going to introduce our guest for today.
Great. Thank you, Leslie. Excited to be here. Over the last 8 to 9 weeks, we've been sharing a lot of information about how to operate in this new COVID-19 world from a public health and safety perspective, how to also keep yourself safe during these difficult times. But now we wanted to change it up a little bit different. And we've invited Kyle Roste, Leslie's husband, who is a licensed therapist, to talk about your mental health as well during these times. We know a lot of you are concerned. Your stress level is probably higher than it's ever been. And Kyle's going to share some ideas and some thoughts because he's been doing this on a regular basis with his clients over the last 8 to 9 weeks as well, of some exercise and some things that you can do to make sure your mental health is as strong and solid as the health that you're providing for your clients through the use of our Barbicide certification programs, our COVID-19 programs. But now, today is about you. Today's for you, the stylist, to make sure you're protecting your mental health as well. So with that, I'm going to turn it over to Kyle. And Kyle, thanks for joining us today.
Thank you. Again, my name's Kyle Roste, and I'm a therapist. I'm in Overland Park, Kansas, and so I'm a licensed clinical social worker, and so I'm providing therapy for a lot of different populations. So when I started or continue to do therapy, even during COVID-19, nothing really changed for me. So I'm able to kind of give you, some feedback and some information on what that's been like from the time that this hit to kind of where we're at now. So I've been working with a lot of teenagers, a lot of parents, and getting a lot of different variations of how people are responding to this and kind of where we're at right now.
Well, thanks for having us. And by the way, as his wife, I can tell you that it's clear he's loyal to his stylist. No haircut yet. It's coming. It's been a point of pride in my house that we don't do that to our stylist. But so I want to ask you some of the questions that we've been hearing out in the field when I'm talking to people, that type of thing. Even though a lot of professionals have already returned to work, there's a lot of pressure on them to make up for lost time. They have clients who are concerned, clients who really vehemently want to wear a mask, clients who definitely don't want to wear one, regardless of whether they're supposed to or not. And all that's really taking a toll on the professional stylist. What are some of the most important things that they can be doing daily to reduce the risk of things like anxiety and depression?
Yeah, one of the first things that people have to keep in mind is sleep. We don't give that enough credit. But even before all of this, I help people with just trying to recognize the common basic things that are helpful. And when we have sleep deprivation, we're going to experience a lot more anxiety, depression, and mood swings. So the first that I would say is sleep. But also, a lot of people are also recognizing, even up to this point, as things are starting to open up in the communities, that just getting up and having, a good routine, getting up in the morning, taking shower, eating breakfast, and just as if you are getting ready for the day, has really also been helpful. But I would say first and foremost, making sure that you're getting good sleep, not staying up too late, not sleeping in too late during the day is also something to keep in mind.
How do you feel about, I saw something recently on the news about turning off your electronics an hour before you go to bed. I'm sure that a lot of our stylists are getting bombarded by people who wanted to get in the first day they opened or are trying to get them to do something. How do you feel about the whole electronic piece in good mental health?
This is something that I have to help parents and teenagers manage in general, but this is really ramped up in light of COVID-19. That it's really trying to get away from the electronics and also finding other things that you can do during the day and turning off the cell phone, getting off the gaming systems, and if that also means not listening to too much media on everything can really cause a lot of stress. But I think really trying to work on managing the electronics, whether it's gaming systems, the cell phone, iPads, and I totally agree that when we're able to do that more, like an hour before we're getting ready to go to sleep, because it can increase like serotonin and the functioning in our brain, taking it longer for us to kind of slow down and be able to go to sleep. So I totally do agree with that.
So you bring up a thought process here that sometimes we watch too much media. This is on the news. It's on every channel we watch. It's everywhere all the time. And, should we be structuring how much of this we hear? I mean, limiting ourselves, does that reduce our stress level? Or for some people, does knowing more make them feel better? How do you feel about that?
I think it depends. Part of the anxiety is we're hearing so much information from different parts of the world that a lot of the clients that come in to see me are wanting to process and even just vent about some of this information, that some of it can be inaccurate and some of it's too much information because it could be just kind of a part of information overload. And so I think if you have, I don't know if there's one good source to listen to, but in general, I think a good rule of thumb, also based on what's helping others that I work with, is just to manage how much you're not listening to too much information.
Okay. So one of the things that we're seeing out in public everywhere is that there are people that are on a scale of 1 to 10, they are at a 10. I'm so afraid, I'm afraid, I'm afraid, I'm afraid. And then you have people that are like, it's no big deal, I don't care. And there's this continuum everywhere in between.
Yeah.
And if you are the 10, I'm so afraid, and you have to go back to work, or you're the 0, I don't care, and everybody around you is a 10, what's sort of a way to manage the people that work around you, but also in this instance, the clients that come in, the client that doesn't want to wear a mask, even though that is the rule? How do you manage that?
It's really important to get comfortable with talking with people that you're working with, especially if you're not uncomfortable with something. So if there's a general protocol that everybody has and some people aren't following that, it is important for us to be able to talk with each other about that. There are some therapists that are in my office, and we were able to talk about what are we going to do, how are we going to make the office safe for the clients that do come into the office. And I think even for the clients that I'm working with, when they are going out in public, some of them make sure that they have a good plan of attack in terms of how they can feel safe, because we can't control the people that are around us, but we can control what we do. So some clients will go out early in the morning to the grocery store, and they'll make sure that they're wearing a mask and doing the things that they can do to feel safe, but they're also willing to change their plan if they don't feel safe, and they'll go to different places in the community when they feel better and more secure in that. But getting back to the work environment, I think it's important for in the cosmetology industry to be able to talk with each other, but being prepared that clients are going to come in and they are going to feel nervous. And there's that's the approach that I take with my clients as well, that I know some of them are going to come in and feel nervous, and I'm always real careful to talk to them about what I'm doing to keep the environment safe and what I'm doing to disinfect, if that answers your question.
Well, you are a well-trained professional and what to do to keep people safe and feel safe. Nothing, no shame there. Okay, so likely when people go back to work, in this industry, a lot of them haven't worked for 2 months, and so they're going to be trying to make up time. So they may be working 7 days a week. They may be working extended hours. All of those things, their environment has totally changed. They're having to work with gloves on, masks on. All of these things have changed in their environment. And one of the things I've been telling people is that at the end of a service, when you do disinfect, you've got the 10-minute contact time, which you should be looking at instead of as it being your contact time, it should sort of be your downtime. And what are some things they can do in a 10-minute period of time that can sort of help them catch their breath? What can they do to make, recenter themselves during those 10 minutes?
What I think is important is just to get into a routine and to be okay with taking that extra time. I know when COVID-19 hit and I continued to see my clients, it was different. I didn't see as many, and I had to be okay with things being different and things changing, and just taking our time with readjusting. And I would strongly advise and suggest that they not try and do too much in one day. If your numbers are, if you're used to 20, 30 in a day and you have 10 or 15, to be okay with that and just take your time in between clients and doing what you need to take care of yourself. There's a teenager that I work with, and they have to wear a mask at work, and they have to do, it's like one of our favorite Mexican restaurants. And she said that she has to take a break about every 45 minutes just because it's really hard to wear a mask. And she could tell that she's kind of getting out of breath. So there's places where they can go to take about 5 or 10 minutes, to take the mask off and just, regain their composure and then getting back to work. So those are just some suggestions that I would make.
So some people have had bouts with things like depression and anxiety in the past. Those people are probably very comfortable with when they go see a therapist or when they, do whatever they do to cope. But what are some signs somebody should be looking for that maybe they do need to go see a therapist, or maybe they do need to talk to somebody? What are some things that would be hallmarks of I'm not dealing with this in a way that's good for me, healthy for me?
I think, again, the first thing, getting back to sleep, when we recognize that we're not getting enough sleep and we're laying awake and it's hard for us to get to sleep, or we're waking up a lot during the night, that's going to be one sign. But also there can be a decrease in anxiety where we're feeling nervous about things that we're not sure where it's coming from. Sometimes when I'm helping people with anxiety, we talk about real versus imagined anxiety. And sometimes the imagined anxiety, or it's just our heart rate starts to increase, or we're just getting butterflies in our stomach. Those are more just kind of symptomatic that can be, signs of having some struggles in light of COVID-19. Sometimes when we're feeling not as interested in some of the activities that we used to do, and we're just not feeling as much energy, can be more signs of depression. And so lack of appetite and just inability to concentrate, all of those can be just some of the basic signs that could be helpful to go in and see somebody just to be able to talk and to process through what's been going on and all the, not only just the changes, but the uncertainties in the future.
Right. I mean, there's not a lot of things to look forward to. Events are being canceled, graduations, weddings, that kind of thing.
Right.
I think we all feel like we are eating more, drinking more, exercising less. We all feel like everything is just flat all day long. Are there things we can do at home that might help us get past, that sort of feeling, of, I'm just sitting here doing nothing to look forward to, gaining weight, being unhealthy, drinking too much? What are the things we can do to really get on task with that? I know you talked about a routine. What about diet and things like that?
There's a lot of talk about nutrition and trying to decrease sugar intake and just being aware of what we're eating, just to have good healthy nutrition, whether it's a good breakfast or a good lunch. Again, I resort back to a lot of the teenagers that I work with that don't eat healthy in general, but even for adults, it's an important thing to have 1 or 2 good meals, but just to recognize where we can cut back on some of the things that might be unhealthy for us. And yes, it is important to watch our alcohol intake for sure. But just recognizing our eating habits and those things that can be helpful, also that can contribute to good mental health.
So one last question, and then I'll let you say whatever you want to say, or Alan, if you have a question, you can ask it. But one last question I do have: if I do feel like I do need help, if we hear about people who, it just comes up kind of on them kind of quickly, and if I do feel like I need help, what resources might I be able to find in my own community to be able to find someone to talk to?
Yeah, the quickest way is to go to Psychology Today. So for me, I have a Psychology Today profile. So if you go to psychologytoday.com and you can put in your zip code, and it'll come up with all the different therapists that are in your area. And then you can also look at their profile if they're in network with your insurance. And there's a function on there for us to be able to indicate that we can do Zoom sessions or FaceTime sessions or in office. And so it's good to know that you can look at that and get some good information. And they make it really easy that you can also email that therapist if you have any specific questions.
Alan, do you have any questions? You are on mute.
All right, I got it. Unmute my audio. Okay.
That's right.
So thank you, Kyle. And we'll be sure and put a link to that website on our website so that if you need it, you can easily find it on barbicide.com. Kyle, I wanted to kind of follow up on a question Leslie asked about the individual, but what if I'm a manager or a coworker and the individual themselves aren't recognizing it, but I'm visually seeing mood swings, I'm seeing indications that this individual may need some help. What are some of those indications that I might observe? And if I do observe them, how do I have that conversation with a coworker or an employee to say, maybe you should get some help or maybe you should talk to somebody?
I think part of some of the people that I'm working with, that's a great question, is that's where a good use of HR comes into play. And there's a lot of programs within some of the companies in their HR program that are able to make that really easy and accessible for your workers and coworkers to be able to get that help that's needed. And it's really hard to be able to approach people that might be resistant to getting that help. And I think it's trying to be really patient as much as you can in approaching that, to help people that you see might be struggling. And either way, it's kind of hard to approach that when people might be resistant to it. But I think being as patient as we can and making sure that they know that there's support out there, even if maybe it's sending out a group email that we have this support for everybody, and that might help make it easier for different coworkers to say, you know what, I think I need some help, and they can do it in a way where they feel safe, if that makes sense.
Yeah, thank you.
Great idea.
If I could also add, there's a couple of other things, a lot of information that I get through emails. There's different programs that I refer clients to, but part of what we're talking about for people in their day-to-day activities is to try and find different things that you can do that are meaningful to you. So an example is a couple that I'm working with that have to be separate from each other because of COVID-19, but they do like FaceTime breakfast, and they find that really meaningful. And people are finding different ways to have meaningful interactions that are safe, but to just try and make that a consistent activity in your day-to-day. But also there's a good app that a lot of people are using on cell phones, and it's the Mindful app. So it can give you notifications to take a minute just to do some breathing and just take a moment and listen to some music. And it has good affirmations that come across there that just kind of help break up the monotony of the stress that we're going through. And also, if I can leave with a resource, This is the depression cure. And there's a lot of good information in there in terms of healthy sleep and healthy eating habits. And that's with Stephen Alardi, who is actually here in Kansas City. So just a couple of good resources that I want to leave everybody with.
Well, thank you so much.
That's all I got. You're
Yeah,
welcome.
well, it's plenty. Thank you so much. We're going to post this on our website and maybe get some more questions. And then we may either ask you to come back and interview with us again, or just answer the questions, and we'll post them at barbicide.com.
Absolutely.
Really
Yeah,
appreciate your
absolutely.
time, and your
Thanks
stylist.
for having me. I appreciate it.
And your stylist really appreciates your loyalty on the haircut.
Yep.
Yeah.
Thank you so much.
You're
Thank
welcome.
you. Thank you.
Okay.
Thank you all for your support. And again, we're here for you. Reach out to the resources we're providing, and know that that we're here for you. So have a great week, and look for our next series coming up soon.
Thank you.
All right.
Bye.
Bye.